onboarding is something that can either break you or make you as a nurse practitioner or a nurse. So we're going to talk a little bit about, some of the things that as a nurse practitioner, we need to get ready for our onboarding process. So you can actually get into, the hospital on time in terms of to start work. If it's a clinic, mobile practice, home health, whatever area you're going to be working in, these will help with getting you prepared. If you're new here, I'm Stacey, and I want to say thank you so much for tuning in to the Think Nursing page, where we talk a lot about nursing, travel, and lifestyle. So usually when it comes on to licensure, there are so many things that you need to get. So the first thing you need to get is your active RN license. That is usually state specific. You also need your advanced practice registered nurse license. Must be like, AGNP, FNP, psych, CRNA, whatever it is. Make sure you have all of those certifications done already. If you're going to be prescribing medications, you need to get your DEA for your controlled substances. You also need to apply for your NPI, which is your, for individual NPI. The company that you will be working, they will provide their company NPI when you're doing your application. We also need a collaborative or supervising physician. So if you're going to be working with a practice, a lot of times they already have their own providers. So you don't need to be worried about that. If you're creating or you're starting your own practice, then depending on the state, you might need a collaborative physician or agreement that you're working with. Also, malpractice insurance is something that is recommended. Some companies want you to put their names on it. Others, you just get a general malpractice insurance. Other companies are out there that they will provide their own malpractice insurance to you. You also need to get proof of your education. So your Master's of Science in Nursing, your DNP, whatever it is, the transcript is needed. And you also need a government issued ID. It's a very long process. So I would encourage persons to make sure that you go ahead and as soon as you get your offer and you sign it, you look out for your email. Keep on checking your email, check your spam to make sure that you're not missing out on any emails that needs to be addressed immediately. Usually you also have persons from the office that will help with getting you started. And these are like, your CAQH profile. Just make sure it's up to date. That is a profile that is created, all of your credentials. So if somebody needs to find you, they can just go onto your cash account, your CAQH account, and they see everything. And if they go there and they realize that you don't have everything, they probably won't offer you. You understand? Because if they go there and they don't see a DEA, they don't see a NPI, they don't see certain certifications, they're not going to choose somebody else who already have a CAQH account that has everything ready to start working today. So just make sure you create your CAQH profile, because that is very, very important. Also, if you're working inpatient, then you want to make sure that, you have hospital privileges, insurance paneling. Those are things that they will also assist with. They need your resume, and they also want to look at your work history for the last 5 to 10 years. It's also good to have some professional references or peer references. So some companies will ask for up to 3. So make sure you have some persons that you have in mind that can be used as references. For house call nurse practitioners, sometimes it can be very, very tricky, because remember, you're working independently, you're working alone. So you might not have anybody. I'm just hoping that companies will take that into consideration, and then from there. Background check is something that they definitely want you to get up and running on day 1. So as soon as they send out everything, just go ahead and give a consent on that, so you can start the process for your background check and also for drug screening, because sometimes these takes a little bit longer. Then you also are required to get your immunization. They're going to want to know that you have your MMR, hepatitis, flu, COVID, depending on the institution. Your TB test, sometimes they want a quantiferon test to make sure that, you are good to go with that. Physical exam clearance, a fit test, BLS, ACLS, PALS. And as I say, it depends on where you're working. Because if you're going to be working in the hospital setting, then these are a lot of things that is going to be required. If you're going to be working in the outpatient setting, sometimes, they're not so strict on getting some of these things going. You also have some paperwork for HR that you need to go ahead and do. As I say, you sign your contract, the offer letter. There is also the I-9 and the W-4 form that you need to fill out for taxes. You also need to provide your direct deposit form. Benefits enrollment, you need to do that. The employee handbook acknowledgement, sign off on that. And then depending on, if they want an ID or badge going, they want to take a photograph. So make sure you have that in mind. Clinical onboarding and training. This is where, a lot of persons are struggling, especially the nurse practitioners, if they don't have the support. So make sure you have a lot of, support when it comes on to EMR training. You need that. A lot of companies will use like Epic, Cerna, Athena, eClinical Work. So find out what EMR system your company is using and try to ensure that they provide you with adequate training. So when you get out there, you feel comfortable with documenting the patients. Documentation standards, billing and coding. Some companies will go ahead and have you do your own billing and coding. So you need to understand your ICD codes and all. Clinical protocols and guidelines, prescribing workflow, referral processes, prior authorization, lab and imaging ordering, patient messaging system. So a lot of companies will provide you with detailed orientation on all of those. So as you go along, you can have an easy flow in terms of your work. Then you want to ensure that when it comes on to productivity and performance expectations, you want to clarify upfront certain things like, the amount of patients that you'll be seeing per day, per month. You need to have an idea of what that looks like. The length of time for your appointments. You want to ensure that you look at productivity models. What are they using? Are they using salary, bonus, RVUs to pay you? Find out what that looks like. Documentation turnaround time, you need to have an idea because they don't want to be a case where they tell you that you still need to see 30 patients today and they want the notes by the end of the day. That is going to be a little bit tricky. So make sure you find out the documentation turnaround time for you so you can plan accordingly. Call schedule, find out if you're going to be on any call schedule and what the expectation is. It's a case where you're going to be staying at home and just taking the calls, or it's the case where you're going to have to take the call and then show up to the facility. You need to have all of those clarified. All right. Then when it comes down to equipment and access, make sure you receive either the company own or let them go ahead and tell you how they want to go about with you using your own computer. Some companies will have you sending information for the serial number, the model, so they can keep track of certain things, make sure that it is safe and it is, up to standard for them with their company. So sometimes you might need a laptop or a tablet. They will give you your EMR login, e-prescribing access, secure messaging access. If you need an office space, especially if you're doing like a home visit, for home visits, and prescription pads if needed. So things like that, make sure you receive all of those and you get accurate information as to go about with accessing them. Then when it comes on to onboarding as well, you want to talk about mentorship. A lot of time that is overlooked. So want to find out if there's going to be somebody that you can, use as a preceptor. You can have a mentor. Shadowing period, is that something that they're going to be providing? Regular check-ins, try to see if that is something that is going to be happening every 30 days, 90 days. Continuing education support and orientation checklists. Make sure you get those because you want to have some form of structure going. You want to be comfortable with, knowing who you need to talk to regarding certain things while you're on the job. One thing that nurse practitioners should prepare for is, when it comes on to going in for work, you want to show up, even when you don't know the information, show up with all the relevant, resources that you need. So you get your stethoscope and all of those things ready. When it comes on to pocket references, UpToDate is one of the, the most commonly used reference sites or that a lot of persons will be using. Personal malpractice insurance, as I say, that is something that you definitely want to get for yourself. Notebook for clinical pearls, drug reference guide, copies of protocols, and make sure you're having boundary settings. Strong onboarding makes patient care a little bit more safer. It also ensures that you're not feeling burnt out or stressed or exhausted, and it also provides some form of confidence for the provider. So always advocate for good support during your onboarding, the onboarding phase. Ask all of the necessary questions that you need so the process can be very smooth and you can have a good transition into your role as a nurse or a nurse practitioner. I do hope that these tips were beneficial for you. If so, go ahead and give the video a thumbs up, a like, a share, and most importantly, subscribe to the YouTube page here at ThinkNursing, and also follow me on TikTok where I talk about nursing, travel, and lifestyle. Until then, I will see you in the next video. Bye.